I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, renowned Eastern medicine practitioner and holistic fertility coach, Dr. Juli Yelnick returns for a conversation that could change the way you see your body, your diagnosis, and your future. PCOS is one of the most common fertility challenges women face, yet so many are left feeling overwhelmed by their diagnosis, prescribed unnecessary medications, rushed towards IVF, and told there's no real long-term solution. But as Dr. Juli reveals, PCOS isn't a one-size-fits-all condition or a life sentence. In traditional Chinese medicine, it's understood as a collection of unique patterns. When you discover your personal pattern, you unlock a clear, individualized roadmap to natural conception and lasting wellness. If you're ready to move beyond band-aids and rediscover hope for your fertility, this episode is your invitation to a new beginning. Juli, thank you so much for your time today. It's fantastic to have you back here with us.
Yes, I'm excited to be back. Thank you so much for having me again.
I know, after that last epic episode, I'm so excited to be diving a little bit deeper into a very common fertility and women's health issue being PCOS. So for listeners who may not be overly familiar, can you just briefly explain what PCOS is? But before we get into the Eastern medicine and traditional Chinese medicine perspective, can we talk about what it is from a Western medical perspective? What are the main signs, symptoms, and I guess the diagnostic criteria?
So PCOS is something that I know we very briefly touched on in our last episode, the most common fertility imbalances and things. And PCOS is certainly one of the largest diagnoses that a woman can receive these days. It's estimated that not only the 10% we used to think it was that of women that were affected with it, but now the estimates are creeping higher and higher to 15% or even 20% of women might get this diagnosis. And most of them don't find out or it would never come up until they're trying to get pregnant, or they're at least noticing that their cycles are not regular. And so they're starting to think something might be off. So that's generally when a woman would go and ask something about what's going on. Is there something amiss with my hormones or with my fertility or my health? And that's when they'll be told that they have this thing called PCOS. So it stands for polycystic ovary syndrome, or some people will say polycystic ovarian syndrome, same thing. And you can have it, and it doesn't always look the same if you have it and someone else has it. So while there aren't really agreed upon differentiations between Western medicine doctors about the different types of PCOS, they do sometimes sort of break them out. So you at least have to have two of the three criteria. So the three criteria are no ovulation or really irregular, unpredictable ovulation, high androgens, usually testosterone, which you might notice by like too much facial hair or too much acne, something that's, especially if it's new for you, or even testosterone showing up on a lab test. And then third, you can have cysts on your ovaries, a lot of cysts in the ovaries. If you have two of those three, any two of those three, then you'll get the diagnosis of PCOS, okay? But a lot of women will have these two, and a lot of women will have these two, and some women will have these two. And a lot of women will have all three. So it can truly be any combination of those things, and you'll still get the same diagnosis, which, as you can probably guess, is going to be problematic for trying to treat this hormonal metabolic disorder.
And it does also, I know that PCOS also gets categorized into different types. So it's like inflammatory, adrenal, insulin resistance. Do they present differently? And is there a distinction between those?
Yeah, and that's what I just touched on, where there's not like this one agreed upon breakout of what the different types are,
Mm-hmm.
but you will see a few of those types commonly mentioned. So you will see the one called insulin resistant PCOS
Mm-hmm.
because it is just the most common presentation that we see. And so some women will find out they have that PCOS because they're starting to think something's off with my blood sugar and my metabolic function doesn't seem right. Maybe I'm diabetic. And so they'll go get that type of testing done, and because that insulin resistant PCOS is the most common type of PCOS, that's how a lot of women will find out they have it. The other types are a little less clear and more debatable as to whether they are in fact their own types. Because for example, one will be called post birth control pill PCOS. It's not you have it because you took the birth control pill. So is it its own condition? Maybe it's the reaction to stopping your ovulation with hormonal birth control, oral contraceptive pills. You will see inflammatory PCOS as another subtype that's always often listed. And inflammatory PCOS will be one that is really marked by signs of inflammation. So you might feel, or you might be someone who has really high stress, and you might have gut issues that flare on you, and you just might have this sense of inflammation throughout your body. Trying to think other really popular ones, like there's adrenal PCOS, where it's more about the burnout of your adrenal glands than it is like the ovarian production of your hormones. So our ovaries produce a lot of our hormones, but our adrenal glands that sit atop our kidneys, they also produce some of the same hormones. So while most women who have PCOS will have their hormones impacting ovulation thrown off by their ovarian hormone production, those women whose ovulation is thrown off because of adrenal gland hormone production being off, those would be called adrenal PCOS people. So there are these distinctions, but they're not universally agreed upon.
The fact that you opened up that little can of worms about birth control, I feel like we could go off on such a tangent down there, because I feel like I've got quite strong views around birth control and how it's being used, and the
The side effects
the
from
side
taking birth
effects.
control?
That's the one that I'm
Yeah.
looking for. The side effects, the symptoms, the potential causes of it. I feel quite strongly about this, but this isn't a
Mhm.
podcast about birth control. I feel like there's definitely one brewing around that with me. But when we talk about being diagnosed with PCOS in the West, from a traditional Chinese medicine perspective, how do you approach their case? And can you explain how traditional Chinese medicine understands PCOS and what the most kind of common patterns of imbalance are that you see surrounding it? So that's a huge question and it's multi-layered. So if you want me to
Mhm.
break that down again a little bit, let me know. But yeah, I think this is a really good umbrella that we can start from.
Yeah, and I think it also opens up one of the major differences in how Western medicine views PCOS versus how Eastern medicine views PCOS. It's so ironic because they are starting to notice that people don't all have the same situation, and yet they're willing to label it all one thing. And so when we look at it from an Eastern lens, we're like, it's not all the same thing. So let's divide it out, and we call it pattern differentiate and see what is your root cause of PCOS and what is your root cause imbalance that caused your PCOS. And we can do that for 10 women that have PCOS, and they might all have a different underlying imbalance that caused those things that we are now labeling as PCOS. Interestingly enough, I also want to add that traditional Chinese medicine has classical texts that go back to, I believe that it was cited as long ago as the 1300s describing PCOS. So this is not like a brand new thing, even though we definitely would call it like a modern disease, a metabolic disorder. We
Mm.
largely attribute it to stress and lifestyle of the modern day, but we have recognized these different things that are going on. And what we called something else, they now call PCOS. So we always looked at which imbalance is implicated in this condition. So whereas the West would say it's all about your hormones and metabolism, we would say your hormones are being impacted and your metabolism is being impacted by one of these root cause imbalances. Generally, whenever we're talking about anything related to fertility, and definitely when we're talking about PCOS, there are three organs that are most involved with that. Something could go awry with one of these three organ systems. And that's definitely the case for PCOS. So the first one is the spleen. And the
Mhm.
spleen in traditional Chinese medicine, it encompasses your actual physical spleen, and it also encompasses your pancreas. So it's interesting because they see it as one organ. And in the West, when we look at PCOS, we're mostly looking at insulin. So the pancreas is also implicated here. So it's like, it's all coming around. We all agree. We're just calling it different words sometimes, but we all agree. So the spleen is our organ that is usually going awry, or things are out of balance there. That's going to cause PCOS directly. So your spleen is responsible for all metabolism of nutrients and fluids in your body. And we like to think of our stomach and our spleen, our digestive function in total, as like this beautiful bonfire that's always cooking, or a hot bowl of soup that's always simmering, because that's how our digestive system wants to be. That's when it's happy. When it's warm and liquidy and happy inside of there, we're able to digest really well. And we're able to, so what digestion means is we're taking the good parts and absorbing them and utilizing them for energy in our cells. And we're eliminating the bad parts, the waste products of whatever we've taken in as food and drinks. If we have a deficient spleen, it's just not working. It's cold, it's slow, it's just not happy. So when we eat foods that contribute to that problem, that's what we should expect to see. So foods like cold, raw salads, or cold vegetables, raw vegetables. Of course, juices and smoothies, which are like really concentrated raw cold things, or cold raw things blended with ice or dairy products oftentimes too. Those things really upset our digestive process, and they lead to what we call spleen qi deficiency, or just this lack of spleen, stomach, digestive energy. And the byproduct of that is all this additional gooey, wet junk we call damp. It starts accumulating around the body. And so one of the most substantial manifestations of damp phlegm you can have is a cyst. It's like a gooey ball, right? It's like a wet, gooey, sticky mucus ball. That's a cyst. So when someone has a lot of that going on their ovaries, that's a huge sign that you have dampness, okay? And we can also look at other signs around the body to confirm this. So for us, the main symptoms that someone might be suffering from a weak spleen qi deficiency, we call it, would be that you're always tired. Even if you got a great night of sleep, you're always tired. And you have bloating a lot, especially anything you eat, you're like, ugh, I'm bloated again. And then your stool is often loose, messy. So your stool should always be like a formed one-piece log situation. And if it's like loose and messy or mucousy and sticky and extra stinky, all those signs indicate that you have spleen qi deficiency and that dampness is starting to accumulate around your body, because your stomach function is not this like warm, fiery soup of perfection that it wants to be. So that's like our first pattern of imbalance that most people with PCOS, especially if you do have the cysts in the ovaries, that type of PCOS, that would be your main root cause. You can also check your tongue to see if you have this. So when you look at your tongue, if it's like extra puffy and fluffy looking and tall, and then it has your teeth mark indentations on the side, we call them scallops. I guess it sounds fancier. That's a big, huge sign that you have a spleen qi deficiency and that dampness is starting to accumulate around your body. Other things that we see too are directly aligned with PCOS. Like we see people that have this pattern, they tend to gain weight easily and it's hard for them to lose weight. They tend to have water accumulation, like swelling issues around the body. They can even have a lot of bacterial vaginosis or recurrent yeast infections, because again, dampness is like your extra wet stuff hanging around too long that shouldn't be there. So yeast infections, bacterial vaginosis, even cystic acne, even oily skin, anything around your body from head to toe that seems like too moist, that's another sign that you have too much dampness in the body. So that one I love that one because it's so clear, right? Like on all cylinders, like whatever we think of as PCOS in the West, that's the exact definition of spleen qi deficiency with the dampness accumulation. And so it's so clear, right? That one was pretty easy.
That's amazing, isn't it? It's so fascinating. But even knowing that this went back from a traditional Chinese medicine to the 1300s, that's crazy.
I know.
Let's dive in a little bit deeper into all of this. You've talked about spleen qi deficiency with a dampness,
accumulation, build up.
All right, thank you. So are there any other signs and symptoms outside of the reproductive system?
Yeah, so I try to give both examples. Right? Look at the tongue, which we talked about, the puffy teeth marked tongue. I think I accidentally said too many symptoms and signs that were not related to reproduction.
Mhm.
And I know you asked about reproduction. So the overweight, the swelling things, those are not, I guess, exactly related to reproductive system. But if we want to look at the menstrual cycle, it will also show up there. So we can look at spotting. So
Mhm.
people who have pink or red spotting throughout the cycle, that tends to be from a spleen chi deficiency, because not only is your spleen chi responsible for holding or for warming and digesting all of your food and absorbing your nutrients, it's also responsible for holding things up and in the body. So
Mhm.
like energy, I said people had fatigue, right? It's because they don't have enough energy uplifting in their body. So it's also responsible for holding things up physically, like holding your blood in until it's time to bleed, right? It's also responsible for people down the road who have a bladder prolapse or a uterine prolapse. So anything falling out, it's also linked, therefore, to recurrent miscarriages, things that are coming out when they're not supposed to be coming out or coming out yet. Menstrual cycle, you also might see mucousy blood. So
Mhm.
people think their blood is gooey all the time or mucousy. That can be from that dampness as well. So I think those are the main reproductive system and non-reproductive system cues that your body is giving you. Because again, anytime we call something a sign or a symptom, it's really a direct message from your body about the state of affairs inside your body at any given time.
Mm. So would there be any other pattern of imbalance besides from the spleen chi deficiency that would show
Yes.
up with the PCOS, or is that kind of the main one?
There's definitely more. So that's the main one. And then
Mhm.
I'll do two more if that's okay.
If you'd
Just to
like
kind of
to,
have a
you can,
full,
yeah.
well-rounded picture here because if you're listening and you're like, that's not really me, but I have PCOS, there's a good reason for that. And again, that's the beauty of Eastern medicine, is that we don't think all PCOS is the same. And that's why we don't give treatment plans or coaching models or anything that looks the same from woman to woman. There's no tea for PCOS or supplement to fix PCOS,
Mm.
because it depends on what the imbalance is that you have that caused it. So if all of that spleen chi deficiency stuff for the spleen was not you at all, the second option is the liver. Okay, so again, anytime we're looking at fertility stuff or reproductive health, these three organs are almost always the ones implicated. So now we can go to number two, and that is the liver.
Mhm.
So when the liver, it's the opposite. It's the spleen problem is that it's deficient. There's not enough energy and power in the spleen. With the liver, the problem is it gets too excess, too much power, too much backup and buildup, and things are stagnated and they're not free flowing. And so the blood in your body actually starts to get sluggish and it slows down. And so we call this one liver chi stagnation, or even liver blood stasis. If both your chi energy and your physical blood are both stuck, it could be like a progression, if you will. So if it's just a little bit, we might just call it liver chi stagnation. And most of your symptoms will be around ovulation problems. You'll see like, if I'm charting my BBT, my temperature seems to be really erratic. Towers up and down every day or two, very up and down, almost like a teeth saw type of presentation. And you also tend to be the person that has a lot of problems with, like, painful problems with ovulation. Like you might have pain over your ovaries while you're ovulating. And other people are like, how do you know when you're ovulating? I can't feel anything. You're going to feel it if you have liver chi stagnation, because it's painful because of that backup of liver energy and blood. You also have the bleeding with ovulation sometimes. So that will be from that, especially if it's
Mm.
brown blood or like dark purple blood at the time of ovulation. That's often from liver chi stagnation. And then there's a lot of emotional signs as well. So liver chi stagnation is responsible for mood swings, especially if your mood swing involves irritability and or depression. So if it goes irritable very easily, that's a huge sign. But also it often swings between irritable and depressive moods. So that's another big sign to look for. Your tongue in this case doesn't really show a lot. Sometimes it might be a little purplish. If it gets really bad, you might get purple spots. But if it keeps progressing, that's when it turns into liver blood stasis. And when you have liver blood stasis, things are so sluggish that they start congealing. And again, that's where we can get cysts as well. So for PCOS, the pattern that contributes to cyst is not just a dampness situation. It can also be a blood stasis situation. So when your blood can't flow, it just starts to get stuck, and then it can accumulate and congeal even. And then you can get cysts from that. This also tends to lead to endometriosis, which we can talk about at a different time. But when we start to have tissue forming that's not supposed to be there, like fibroids and masses, these can either be from dampness accumulating or from blood getting stuck and starting to congeal into itself and create extra tissue growth we don't want. So that's another big one. When you have that really badly, you will have also really bad period symptoms and signs, like really stabby cramps, and like the kind that you have to hold onto the table when you get a cramp and that make you want to take a deep breath or you can't breathe. Your period blood will probably be like the purplish, maroonish colors. It'll be dark. And you'll also have clots in the blood. So like grapes or bigger even will be from the same pattern. So that liver, that second organ, can really get messed up and can really contribute to PCOS as well. And one of the interesting associations with this one too is that extra hair growth thing with PCOS. When your testosterone levels are high, it causes extra facial hair and even hair on other places sometimes too. But it's because, in our theory, it's because the blood is stuck in that particular position. So it's over-nourishing the hair follicle. And that's why you get all this extra hair. So it's interesting that the system accounts and attributes or can attribute the modern symptoms that we see back to the underlying patterns of imbalance still, even from hundreds of years ago to today.
That's so interesting. And you mentioned a third one?
Yes. So the third organ that can be impacted here, or that's really responsible for some of these imbalances in fertility and in PCOS too, is the kidney. Okay, so the kidney is an extra special organ. I probably should have done it first just because it's so revered in traditional Chinese medicine, but it's not the first thing that we look to in a case of PCOS specifically, but it's always underlying, and it's usually a kidney deficiency as well. So this is another one where it's like not enough energy in that organ system can cause PCOS. So this one can be a result of overtaxation and taking the birth control pill for a long time. So because the kidney likes to be, or we like the kidney to be happy and fully powered up. And that means that our eggs will be nourished, our uterine lining will be nourished, and we have all the reproductive power we could ever ask for. Like our cup is full with reproductive power if our kidney is happy. But when our kidney is deficient, there's not enough reproductive power. And so either your eggs will not fully be nourished enough to give you a good one each month to ovulate, so you won't ovulate at all, or you won't have enough blood in the body to really have full periods. So you'll see like your uterine lining is not developing. If you're getting ultrasounds to measure it, it won't get thick enough. That can also be this kidney yin deficiency. So they're all different, but it's always an imbalance of one of those three organs that's going to end up giving you PCOS.
So incredible, isn't it? So did we cover the different
non-reproductive symptoms. Okay, so to go back to the middle organ, the liver one, signs that are non-reproductive related for liver qi stagnation really are similar to the menstrual symptoms. So irritability, if you're just irritable all the time, that's the number one symptom. Again, there's not a lot to see on the tongue for this one unless it gets really bad. So if it progresses to liver blood stasis, then you will see more signs and symptoms around the body and on the tongue. So that's when you'll get like the purple dots on your tongue and the red tip on your tongue. And then around your body, you'll tend to have pain in certain places. So any sort of fixed or stabbing pains, we would usually attribute to this, especially if it's like TMJ. So when you have really bad jaw pain right here, when you have migraines that are just the one side of your head, if you have shoulder pain, and interestingly, because ectopic pregnancies will refer pain to the shoulder, that's because it's liver blood stasis that causes ectopic pregnancies as well. So it's all related, but it doesn't have to be just pain on this pathway right here. It can be anywhere in the body if it is fixed and stabbing and really intense. It's the really terrible menstrual pain cramps as well with liver blood stasis. So those are some of the main signs and symptoms that are related to menstruation, reproduction, and also that you might notice around the body. But if you do have a history of recurrent ectopic pregnancies, that's a huge sign too, that that's your pattern of imbalance, certainly. And then if you move to the third one, to the kidney and any deficiencies in the kidney that you might see, this one can be tricky because while it's usually a kidney yin deficiency that causes PCOS, you can also have a kidney yang deficiency that could cause PCOS. So those are going to look opposite from each other. Okay. So kidney yin deficiency would be someone who's usually pretty thin and has a really high libido. They tend to be hot and hungry all the time. And they might even have red cheeks right here. And when you look at their tongue, it's usually small and red and full of little cracks, even if it's pretty advanced. This person is just like high energy, like they're a little ball of fire, right? So they might wake up at night, we have a lot of trouble sleeping through the night. They might wake up a lot and have like vivid dreams or crazy dreams, they might say, and they might wake up hot and sweaty. These are the people who, when they either, if they haven't yet, when they go into perimenopause, they will be the people who have most of the night sweats and the hot flashes stuff. And their mood tends to be more of anxiety. So if you get real anxious at certain times of the month or all month, that could be a big sign that you have a yin deficiency. Men can also have all of these patterns of imbalance too. So I see a lot of kidney yin deficiency in the men who come for fertility. They will have really poor sperm morphology and poor sperm motility and small amounts of ejaculate and things like that. So we can always look all around the body and for men and women to try to see if these patterns are really presenting in someone. And hopefully someone doesn't have every single thing that I've listed for any of those options either, because that would be quite a burden. But some people do have more than others. And it really usually depends on how chronically advanced their imbalance is. If they're constitutionally that way and then they have lived a lifestyle that worsened it, it could be pretty off track. And then that means we just have to work a little bit harder and longer to get you back to center than somebody who's just like a little bit in that direction of that pattern of imbalance. We can get them back on track pretty quickly, comparatively speaking.
It's interesting that you mention the anxiety in relation to this, because I feel like we're talking a lot about fertility here and specifically PCOS. We forget that all of these things manifest in different ways. So, someone that is quite high anxiety would definitely benefit from acupuncture and looking at these different types of deficiencies and stagnations and that type of thing.
Oh, yeah. Emotions go both ways. So the pattern of imbalance will cause that emotional imbalance. And then it will also cause your pattern of imbalance is also worsened by having too much of an emotion. So if you are always stressed out and you're always irritable, it will give you liver qi stagnation. But once you have liver qi stagnation, you will tend to be irritable more often. So it's the same thing with the yin deficiency. If you're kidney yin deficient, you are going to be more of an anxious person. But then that is going to lead you to do things that further tax your kidney yin, like work out a ton and do too much of everything, and then it wears you out and you get more stressed and then you have more yin deficiency. So the emotions are always like a vicious cycle, which doesn't have to be a bad thing. It means that we can use them diagnostically. So we can say, oh, this is your emotion right now. We know what organ system is out of balance for you then. And that gives us like a huge clue of where to enter to try to start harmonizing things for you.
That's incredible, isn't it? So in terms of understanding these patterns, how does that help you tailor your treatment for each individual? Because obviously everything's tailored.
Yes, because your PCOS could be caused by one of, let's say, those three main patterns of imbalance, three organs that I discussed. That means that what we give you and do with you to resolve your PCOS is directly related to which of those imbalances caused it. So we would never say that there's one treatment for PCOS. There's no acupuncture points for PCOS. There's no herbal formula for PCOS. But you can get a ton of help in resolving your PCOS with acupuncture and herbal formulas, but it just has to be the right one for your particular imbalance. So that's why I caution people not to just try to go online and look up what's a great supplement for this. And that's not how it works, right? And unfortunately, if you take the wrong herbal formula for your pattern of imbalance, maybe you saw it worked for a bunch of other people with PCOS in your forum online or something that you're in, and then you run out and order it online and you take it. People think like can't hurt, but unfortunately it can hurt. So it can push you. Everyone wants to be center. And so if you're way over here and you take the herbal supplement that gets you back to here, that's perfect. But what if you were over here already and you take that same herbal supplement? Now you're off the charts, right? Instead of bringing you back to center. So you always want to be coming back to center. And if you take the wrong herbal formula for PCOS, just because it worked for one of those patterns of imbalance, it could really actually harm yours even worse. So we want everything to be custom to you, everything to be individualized as far as what foods to eat more of and what foods I'll have you eat less of. what herbal formula you might take. And our herbal formulas in traditional Chinese medicine are very different from supplements in that they're designed to be taken for a very short term, maybe like a couple of weeks, maybe a few months at the longest. Most of them are not designed to be taken for several months or like ongoing indefinitely, anything like that. And also that they're always like a combination of herbs. So we don't really work in single herbs, or definitely not in chemical isolates like a vitamin or a mineral by itself. We don't do that. We don't do like that one extract from something. We always use the whole plant or mineral or sometimes animal that it came in originally. And we use that whole part of that whole naturally occurring substance on the earth because our bodies know what to do with naturally occurring molecule combinations. So if you have molecules that aren't naturally occurring, like they've been synthetically made vitamins, for example, you can put that in your body and your body's like, I don't know what to do with that. That's not a thing I'm programmed to know how to interact with. So either like you just eliminate it in your poop and pee, or your body tries to save you from it by stuffing it away in like fat cells over here and keeping it away from you because it doesn't want it to interact with your body. So we always want to try to use like naturally occurring things, which is why our treatment strategies are so reliant on food, because we're already eating food every day anyways. So wouldn't it be great if we were spending the same amount of money on food and we were just simply choosing the foods that resolve our pattern of imbalance instead of contribute to it? So that's why it's so important to know, which one of those root causes is yours, because then it unlocks everything. You're like, oh, I'm going to buy these foods now and not these foods, or I don't need to take all these supplements. Maybe I can take this one herbal formula for 1 month or something like that. So it can be very much easier once you know your pattern of imbalance. It doesn't make it harder. It makes it easier because then you have this exact plan and it's not guessing and generalizing and all that kind of stuff.
So in terms of that, could you walk us through how you would approach treatment for PCOS using the 5 branches of traditional Chinese medicine?
Yeah.
So let's just say we had a spleen qi deficiency with dampness accumulation.
Perfect.
How would you approach treatment for PCOS using the 5 branches if you had that particular one?
Yeah, and that's a great one because, again, the signs and symptoms are directly correlated between East and West. I think that's the easiest one for people to conceptualize too. So if someone has a spleen qi deficiency and this as a result of not having enough digestive power and fire, now we've got all this damp goo accumulating all over your body, you probably do have the cysts and the ovaries type of PCOS, which not everyone does, but many people do. So you've got the cysts going on there. You might not be ovulating because the problem with having so many cysts is that you don't have the one dominant follicle every month that then is clearly the one that's going to be, that's the egg that's going to ovulate this month. It's like a fight and there's too much competition and there is no dominant follicle. And so then you won't ovulate, or you might ovulate, but it's a low quality egg because it didn't get to develop so much more dominantly than all the other competition. So this presentation is, and that's why it gives you ovulation problems, whether you are not ovulating or whether you're ovulating with a poor quality egg, etc. And so to treat this, we would address it in all 5 branches of TCM. So we always have 5 ways or methods that we can help someone. It's acupuncture is the one that everyone knows about, but that's not the only one. The entire system was designed to be used together. So some acupuncturists might incorporate some things from these other 4 branches, and often they don't. So it depends on the office they have and the setup of their treatment and their practice and what you might find. Personally, I've moved to a place where I work all entirely virtually, and I'm able to do all 5 of these branches of TCM with each person, because we've substituted out acupuncture for acupressure. So when I say acupuncture, we can always do the same thing with acupressure, which is basically like a self-massage on the acupuncture point that you can do at home daily instead of having to go to an office to get a needle put in that spot. So besides acupressure, for acupressure, we would choose points that drain dampness out of your body because it's got so much damp accumulating, making all those sticky cysts and the extra discharges and infections and things that are just like not supposed to be there.
Mhm.
We would use acupressure points like spleen 9 under the knee on the leg that really helps to drain excess dampness out of your body. And at the same time, we would use points that are strengthening the energy of your spleen so that your spleen is getting stronger and that your digestive power is increasing so that you're not contributing to making more dampness as you're busy trying to drain the dampness of the cysts and things out of you. So we might also use stomach 36 on the leg for that. So a lot of the points people use for fertility, especially, they are on the legs, which is just an interesting fact, but that's just because the channels of the body go top to bottom and down the arms and the legs. And so points that are on your legs are directly traveling to different organs in your body and working on those systems, even though they are not directly located over those organs themselves. It all works. So that would be acupressure. And then we can move on to food therapy, which is huge. Okay, so this is a huge part of traditional Chinese medicine. Food modification is huge. In fact, the old classic textbook saying says, no matter what the person comes to you complaining of, whatever their problem is, first change their food, and that takes care of 90% of everyone's problems. And only if that doesn't work, then you go on to the heroic interventions, they call them, of acupuncture or herbal formulas. So truly, food is a big one. And I definitely do a lot of food therapy, no matter what your pattern of imbalance is. It'll be specific to which one it is, of course. But everybody will get food lists that they should eat more of because those foods are literally like your medicine. Like those are the foods that are directly resolving this pattern of imbalance. And then I'll also give you a list of foods that are contributing to it and worsening it. And those are the foods you should be avoiding. So for this particular imbalance, I would have you eating more foods that warm and raise your spleen digestive function. So that could look like carrots, and barley, especially, and then tell you the foods to stop eating that are contributing to all this dampness in your body. So besides all of those raw, cold things I mentioned at the beginning, the other things that are hurting your spleen chi and contributing to dampness would be dairy products. Ice cream is huge because it's cold and sweet and raw and dairy all at once, so it's the worst offender, unfortunately. But anything that's overly sweet. Yes. So after acupressure and then food changes, we can go on to the third one, which could be the herbal formulas. So this would be a classical formula. Most of them are hundreds of years old, some are thousands of years old. And again, it combines real whole things that would be warming to the spleen and that would be draining away of dampness. So there's some of the formulas are really complex. They have like 15 different vegetables and roots and dried peels and things in them. And then there's some that are really simple. So for this one in particular, there's a formula that's just called it's got different names in English and Chinese, I'm sorry. Two cured decoction is one of them. So Chen Tong is one of the formulas that we use for this, where it's just two little ingredients and that's it. And they just work so well together to drain the dampness that it's all someone needs to take sometimes just for a few weeks, and then the dampness can really leave their body. And then along with the dampness leaving, we see the dissolution of cysts, and we see the reduction of cystic acne. We see the reduction of bacterial vaginosis, yeast infections in the body, candida overgrowths, our dampness in the body. So the herbal formulas can be very powerful, and that's why we use them for such short times, is because they are so strong. If someone were to use that particular formula for too long, it would dry them out entirely. They would have like dryness symptoms. So we have to watch the person. We have to watch their tongue coating, for example. If someone with this pattern of imbalance they usually have that thick tongue with that greasy, thick tongue coat and the teeth marks on the side. We're going to be watching their tongue coat. And once the excess tongue coating is not there anymore, that's the spot. If they keep taking that herbal formula, then it can dry their tongue out and they'll have no tongue coating. And then we know they've gone too far. So we're always assessing their symptoms and their signs to make sure that they're just using these herbal formulas for just long enough to do their job, and then you're done. So the point, it will not be to give you a bunch of supplements to take indefinitely and not be really sure if they're working or what they're doing or if you're done with them, which I know is a huge complaint from women today. Next, we can talk about breathing techniques. So there's things called gasotransmitters, which are basically when we breathe, the way that we breathe and the way that we might either hold our breath or whether we're breathing in through our nose versus our mouth or out versus our nose versus our mouth. All those things impact our gasotransmitters, little messengers to the brain, to the body parts. So if we do breathing, we can do certain types of breathing for each pattern of imbalance. That's why it's frustrating for me to see influencers or breathing classes online, and it's teaching everyone to do the same type of breath work. And I'm like, no, that's going to be harmful for some people's patterns of imbalance. So it's always important to do the right ones for this. So in this case, we want to drain dampness for the body. So we'll do something we call belly breathing, where we basically just inflate the belly as large as we can with a slow, deep breath, and then we release it back. And then we do belly circles, which kind of brings us into the fifth one, which is movement, which can either be you doing movements like exercise, or we can have you get movement done to you, like body work type of things. So for this one, we want to get rid of that dampness. We want to help it drain out of your body or transform into something good for you that's not accumulating in cysts. So the breathing and the exercise movements would be about stimulating digestion, and you'll do certain types of abdominal self-massage for that. There are some general things that I can give that would be good for everyone, not just in these patterns, but those are very general. So it is better to know your imbalance so that we can give you more of those specific types of things.
So how often would it be that you go into an acupuncturist, let's say, and they start talking about this type of stuff? Would they walk you through it, or would they, obviously people can work with you online, of course, and that would be the holy grail. But if you're going into an acupuncturist, and how often would they actually go through this kind of stuff with you and be like, okay, listen, you've got PCOS. What I'm seeing here is X, Y, and Z. Would that be normal? Is that what you should be expecting? Or would that be more in the abnormal side of things?
That's such a great question. There's so much variance in how every single acupuncturist practices. And it's got so much to do with where you went to school and what your state licensing or your country practice teaches you to do or not do, or different, like for example, in Florida, if you're an acupuncture physician in the US, in Florida, you can inject things in the needles into people. That's like unheard of in most of the other states, right? Some states don't even have any licensure. So we don't know what the acupuncturists are doing there. It's a little like Wild West. And then there's everything in between. It's going to take, they are out there. I would like to give people hope. There are acupuncturists out there that are going to do what you just described and that are going to do a little bit of that education and explaining. I am extreme on the other end. I'm all education, all explaining. I thrive in that. I don't know if it's just me or if it's what I feel about this medicine or if it's that I see better results in people who fully understand what's going on in their body, or if I simply attract people who want to really know, like get to the bottom of what's going on versus those who just want the Band-Aid or the quick fix. Like those types of people, when they would come to me, they immediately know this isn't for them. I'm not going to give you one supplement and then you're going to be fixed. That doesn't exist and it doesn't work. And I'm not going to pretend like it's that easy. It's lifestyle medicine is much more, it's more work. It's more work for both of us. So I don't think you're going to find an acupuncturist who's going to go through nearly what we went through today, but you might get one who utilizes some of those other branches of TCM. So you'll get one that does needles and you'll get one that also gives you an herbal formula or they might give you food recommendations. Generally, what they're going to give you are those general recommendations because there's only so much time in each visit. They might have you, to your question, they might ask you to come as often as 3 times a week for a couple of weeks straight. More often, it's like once a week is the expectation. I've even seen people only go once a month. Usually that's more of a logistical issue where they have to commute far to get to the nearest acupuncturist or something like that. I liked to tell people when I practiced in my in-person practice, if you want to affect a lot of change, I do need to see you every week. If we're at a place where we're just keeping things good, then we can definitely go to monthly, or we can focus you more on the education parts of the lifestyle medicine that you're doing at home, the breathing, the movements, the foods, all the other parts that matter so much too.
I just know from my personality type that if I was going to see someone for acupuncture weekly, I'd want to know where are we at in this journey?
Yeah.
Starting from here and based on the conversations that we've had and optimizing health and that type of thing, I'd want to know, okay, we're going to start here because this is what you're coming to see me for. And we're trying to do XYZ and this is the pathway that we're going to take. And then when we finish that pathway, we're going to see what's coming up, because then maybe something else is going to come up after we've cleared this, something else is going to come up here. And then once that's cleared, be like, okay, great. I'm really happy with how we've gone with this pathway. Now we're going to work on this because this has come up and this is now the louder thing. Does that make sense?
Absolutely. And I agree with you entirely. I think it's people want certainty and they want explanation. They want to know why. So what Western medicine is not giving anyone is the why. Why did you develop PCOS? They don't know. The best they can do is tell you your cells are insulin resistant. Okay, why are my cells being insulin resistant? None of them are going that far at all. They're like, metformin will make them more insulin friendly. Okay. Band-aids, right? So the people that want to know the why, and then they want to know the how to resolve it, and they want to know the what to do to prevent it from coming back that way, those are my people. Those are the women and the couples who I'm attracting into my fertility coaching, because they're like you, they're like me. They want to understand. I think, not to throw my colleagues across the world under the bus, but like, you will be hard pressed to go to an acupuncture office and find that, especially more than once. You might get that type of conversation on your first visit, but not on every visit. That would be really intense. So I like that there's a plan now that I can give people that says, this is what's going on. So here's where we're going to start. And like you said, here's how to know when we've achieved that part. And then here's the signs. I call them graduation signs. So I'll say, yes, this woman has PCOS, but when I look at her patterns of imbalance, maybe she's got a little bit of the damp phlegm accumulation thing, but maybe she also has some blood stasis. And those two are very common. That's why that was my endometriosis right there. It was a combination of these damp phlegm balls and this blood stasis causing adhesions and all this pain and stuff in the body. So they're very often together. So the problem that you'll see with most acupuncturists who are only using needles is that they're going to try to treat that person from day one for both of those patterns at once, or they're going to go for whichever one they think is bigger or worse. And that can give people some improvement. And that's actually why it's tricky, because it gives you a little bit of improvement temporarily and you think it's working. And then maybe you stop going to acupuncture as a result. And then things go off course and you're like, oh, I plateaued, or, oh, I got worse again. Why did that happen? It's because there wasn't a plan. Okay. So now everything that I'm able to offer people is so much more organized. It says there is an order of operations in the body. We do need to respect the way that the body works and the order in which its systems want to heal and work to give you the best results, but also long-lasting, sustainable results. So I will start you by saying, for someone like that has two patterns of imbalance, let's say, going on, I'll explain that we have to start with the dampness part of that. We have to open up your elimination pathways first in the body. We have to let that damp start to drain out before we start moving your blood around, because we don't want to be flinging the goo around your body, right? As I tend to say, it's a weird metaphor, but that's what's happening. We want to get some of that goo out of you before we start moving your blood that's stuck and then spreading everything around. So when we have a plan, we can explain to the person, we're going to do this damp thing first. And then we have graduation signs that say, if most of this is better, looking at your tongue, looking at your next period, looking at this, looking at that, then we're going to move to the next step, which is going to be moving that stuck blood that's causing you part of the problem. And then here's how to know. Here's your list of graduation signs to know when we've accomplished and you've fixed all of that stuff. And then we'll go to the next stage and check your next body system. So that's how it's so much, I think, more peaceful for people to work through when they have a plan like that has the order of operations, the graduation signs to help you know when we're going to be moving to the next thing, and to just give people a little bit more certainty in what is definitely an uncertain experience for most women.
And for anybody listening, Julie went through all of these stages in so much detail in the previous podcast. So I think I might even pop that in the description so people, if they're looking for it, they can easily go to it. So you did a beautiful job going through all of those stages and all of the different branches. So if anyone's interested in that, feel free to go to that podcast and then you can come back to this one or just get a better understanding of it. So yeah. But those stages pretty much do determine where you start. Is that correct?
Yes and no. We're always going to check for certain things before we would check for something else. but not everyone's going to have findings in each thing. Right. So I might start by making sure someone's elimination pathways are open, but what if yours are? Or what if, it takes a day or a week to get them open? Great. Now we're already ready to go to the next thing. So it's not that everyone's going to have to do stuff in each stage necessarily. It's just that we need to check you for each of those things in that order. Because if we just start jumping around and like trying things and not really knowing what's going to happen or like what you should expect, that's when we run into problems where, again, you might get like a little, like metformin, for example. Western medicine's favorite answer to PCOS is to give people metformin. It's a Band-Aid, right? It's going to make them feel like, oh, this is it. This fixed me. But it's just a temporary cover-up. It's making your cells more welcoming to the insulin. Yes, it is. So it's lowering your insulin levels in your blood. You're not pumping out as much. You're not creating as much testosterone now. Things look good. You might even ovulate better, right? This is seemingly great. But it's temporary and it's a Band-Aid. Once you stop taking the metformin, you're back in the same boat. And it's very cold to the body as well. So this is the irony. Okay, the irony of Western medicine's treatments of PCOS are that they are birth control, which is cold to the body and causes things like cold uterus, and metformin, which is cold to the body and causes things like cold uterus and spleen Qi deficiency in both cases. So it's almost like they're using the same thing to cover up, Band-Aid, temporary fix the problem as the thing that caused the problem in the first place, which is all this cold stuff. So it is a vicious cycle. And I appreciate that our medicine gets to view it in this very thorough, very comprehensive way where we get to the bottom of it and then work your body systems through so that you get that long lasting effect, the sustainable results. So that if I work with you this year, you might get pregnant and have your baby this year, but in 4 years from now, when you want to get pregnant again, and in the meantime, you get to have these like regular periods and painless periods and regular cycles and all those good things for the long term too.
And I think that opens up a whole other kind of area, because I think a lot of people, when they are trying to fall pregnant or they're facing issues like PCOS in relation to infertility, a lot of them are looking for the quick fixes because they want to get pregnant now. And unfortunately, a lot of these more long-term health solutions that we're talking about here, they don't delay it. It's you just need to have a little bit more time. And then it brings up the whole scared factor where once women start getting into that 35, they're like, oh my God, I don't have any time left. I'm running out of time. But I think the narrative that we need to be telling women is, you know what, you actually do have a little bit more time if you do the work and focus on your overall health and well-being and your stress levels and your sleep and all of these other really important health indicators. You do have a little bit more time, and potentially it's going to be better for you and your child long term if you actually take some of that time now. And you use that time and you focus on your health and well-being now, and you fix some of this stuff for your longer term health and well-being. You do it here, and then you go on your conception journey. And then it's going to be better for you on the other side as well. And we've got a little parrot that's just come and sat on my balcony. So see, look, nature's agreeing with what I'm saying.
That's right. Bring fruitful birds to your that's beautiful.
I wish I could turn the camera around because he's very cute.
That's so cute. Yeah, that's so important. I completely agree. And I do feel like there are younger and younger women who are actually coming to me for preconception care, which I think is amazing. That's getting out. That's a thing. But I also don't want people to think that to really get to the bottom of it and resolve your PCOS or whatever fertility imbalances that you have, that it takes years. Certainly not. It can take just a couple months. Last month, there was a woman who simply got through the intro section of my work and then was pregnant that next month. I have plenty of cases of women who I work with that were pregnant 1 month, 2 months, 3 months later. That's very common. So it doesn't have to take years to do it the right way. It can take just a couple months for some people. So it is important to put in the work, but that doesn't need to be like overwhelming. It doesn't need to be like a years long process by any means. It's something that you can definitely you can be trying to conceive even while you're doing my process, for example. And the benefits that it's giving your future children are huge. There's just more and more research coming out about, you can use Clomid and you can use letrozole or whatever the medicines of the day are to force ovulation in these women with PCOS. You can force ovulation to happen. It will shoot out an egg in many cases, but it's not going to be a high quality egg. Unfortunately, it's an egg that your body was like, no, we should not send that out. And then the medication was like, override, you have to send it out. And then we get low quality eggs, which lead to higher risk of miscarriage or genetic abnormalities or X, Y, and Z. So it really does matter to do the work to nourish your soil for your health. You'll have an easier labor and recovery. Your baby will be better off in so many ways. So it is important. I really think it does matter.
So in terms of Eastern and Western medicine and approaches, is there a way of bringing them together a little bit, or like even them complementing each other?
I think yes. And that kind of goes back to I touched on earlier, there are some general suggestions that I can give that help a lot of people a little bit to a middle amount. And that's what Western medicine would say. They would say more exercise. And if you lose weight and exercise more, it will help your PCOS. And that there is truth in that, but not the way they mean it. Okay. So it is really good. Everyone should walk. Walking is the best exercise for everyone in every stage. It's always safe during pregnancy, before, after, everything. Walking is excellent. It's how you release liver qi stagnation. So when we walk, we're doing the gentlest form of full body circulation. So walking is always indicated, and that would fall into Western medicine's get more exercise kind of category. The other things are about food. So eating, they would say eat healthier. I agree. They should eat healthier. But that specifically means eat your foods cooked and warm, and drink warm and hot beverages. No ice drinks, no cold beverages, no raw foods in most cases, including salads or smoothies or juices. Those things are all contributing to spleen qi deficiency and dampness, which is our main cause of PCOS. So there are some things that we would agree. They would also probably say in Western medicine, work on your stress and improve your sleep, right? Those are great general suggestions that they would give someone for this. I would agree. We do a lot with sleep in our stage 3 of the program, which is about the qi stagnation again, and like helping things circulate more freely and to release any of those stuck blockages and accumulations that you have going on. Reducing your stress is just a good idea for hormone balance in general. Nervous system regulation and dysregulation is something that I'm seeing a lot of in influencers, social media, even from functional medicine doctors in Western medicine. And so we definitely agree with that as well. The beauty of the way that I do things now is that it includes all of those things. So we're going to get your inflammation under control, right? We're going to get your gut health under control. We're going to get your nervous system regulated. We're going to increase circulation and enhance your cardiovascular work. We're going to make sure that your hormones are naturally balancing themselves so that we aren't forcing them back in a synthetic way anymore. So they're saying the same thing we are again, right? It's just that we're using different terms to describe it. And I would argue that Eastern medicine is giving you like more concrete ways to do those things rather than just saying, eat healthier, get more sleep, lower your stress, right? Those are like blanket statements that people can either say, yeah, that sounds too hard. That sounds like everything. And I don't know what specifically to do about that. So at least we get to say, we want to get your stress down, and here are the ways we're going to do it. And here are the things you can check for in your body to see if that stagnation is out yet. So you know if it's working, kind of thing.
It's amazing, isn't it? If there was one thing that you wished more women with PCOS understood about their condition from an Eastern medicine perspective, what would it be?
I think that it's about the differentiation. So don't accept one generalized answer as what is going to fix it. Or don't accept the answer that there is no fix for it. I guess that should be my main thing. It's not an incurable disease. It's not something that you have forever. It's definitely a pattern of imbalance that shifts over time and according to your lifestyle factors. So lifestyle for us means every exposure you can have, from your stressors to the food you're putting in your body, to the air you're breathing, to the water you're bathing in. Everything matters around you in your environment. And that is what causes your patterns of imbalance. So I don't want that to be overwhelming to people. And it's definitely not blaming people. It's empowering you to know that there are so many ways we can change your PCOS, and that you should expect improvement, and that you can figure out why you developed it. And you have options that are natural and good for you that can help you resolve those patterns of imbalance. So yeah, that's my main takeaway.
And then I guess they're just more tools in your belts that you can draw upon further down the line. Like all of these things and all these changes that you make, they're not just for that little fraction of time in your life. They're like long-term tools that go into your health and well-being toolbox. And then you just keep pulling them out when you need them, or you continue them. Or if there's one thing that's a little bit more intense, you might put it over here for a little bit. And then you're like, okay, I'm feeling a bit XYZ. I'm going to pull that out of my health and well-being tool belt, and I'm going to incorporate that back into my well-being practices.
Yes,
Because
you got it. That's it.
yeah, because I feel like
Just go back.
sometimes well-being practices you can let them get a little bit overwhelming, and because there's so many things out there that you can do and that you should be doing apparently around your well-being. But I think this almost gives you a really good outline of what things are good for you.
Yeah.
That makes sense, rather than like even like that breath work, like what breath work should be good for this and or that, rather than being like, oh, I need to do XYZ breath work and there's 20 different types of breath work and which ones should I be doing? Or
Yeah. Yeah, that's it. And I like to train people too along the way, like almost subconsciously, where it's like by the end of the time, after we've worked through all your body systems, I want you to have these like symptom sets basically, where you're like, oh, I'm getting all this cystic acne again. I've had 2 yeast infections this month. I think I'm getting the dampness back. Oh my gosh, I've been eating a lot of ice cream and mozzarella fried cheese sticks, and I've been drinking ice water every day again. And you're starting to think, oh, I have all these signs of dampness again. And now I know why it's happening. And now I can mentally go back to my stage 2 practices, and I can say, oh, I need to switch to those types of foods for a while, or maybe even take that herbal formula for a week and do that breathing practice, right? And then get all those damp signs and symptoms to go away again. So it gives you this natural toolbox, but it also gives you these like symptom sets in your head where there's no more randomness to your body. There's no more, oh, I don't feel well, but I can't quite pin down what's going on. No, you'll be able to say, I know it's liver qi stagnation again. I'm irritable. I'm waking up between 1 and 3 a.m. every night. I have ovulation pains again. Like it's that stage 3 stuff I need to go back and work on again. So it is empowering, and it does teach them how to go through and work through body systems as they see them starting to go out of balance again. That's the best time to address things, right? Is when they're just barely going off track, rather than waiting until you have a full-blown condition that's diagnosable in Western medicine again.
Absolutely. I think that's such good advice. And I think I've asked you this question before, but if you'd like to answer it again, what's the one thing you wish all women knew before having a baby?
Before having the baby, or can I do about pregnancy?
You can answer that however you'd like.
Last time I did talk about lactation consultants, which are gold. So this time I'll talk about pregnancy. So one of my fun facts that I like to tell people lately is that in traditional Chinese medicine, there are things that we do for placenta previa. So I know that in Western medicine, they'll just say, they told me for my second baby, they're like, you have placenta previa, so the placenta's growing too low, it's covering your cervix, you're going to have a C-section. And I just believed them 15 years ago because I didn't know any better. I thought, yeah, that sounds pretty permanent. And now I since have learned through learning Eastern medicine that there are herbs and acupressure and acupuncture that actually the placenta moves up into a higher position in the uterus, and then women can go on to have healthy vaginal births. So I just want to say again that things that you are told that there is nothing that can be done about them, always push a little deeper and question those things about your pregnancy and birth, because so many of them can be influenced and improved when we're led to believe that they're not.
I love that. And I love that that was like a complete sidestep as well, like totally unrelated. I'm like, this is really important. I love that.
It just keeps coming to my mind every time I talk about like my own experiences with infertility and overcoming those types of things. I'm like, and that's the one that I never got to address in time.
Amazing. There you go. You heard it here first. Okay. Thank you. So it's really important because it does happen, right?
Yeah.
So just knowing that there's things that you can do for that. And now I know. So if someone comes to me and be like, I've been told that I've got placenta previa, I'll be like, actually, in the traditional Chinese medicine practice, there are things that you can do to potentially help move it around. So
Yeah.
if a vaginal birth is something that you'd like to do and it's in your birth plan as what your ideal scenario would be like, then maybe you need to go and explore that option.
Yeah.
So thank you
Just
for
a tip.
that. I've got another little feather in my brain
Right,
around
that's right.
pregnancy
File
and
it
birth.
away.
Thank you so much for your time today, Julie. It's always so amazing to talk to you, and you're such a wealth of knowledge. So I just know that anyone that works with you around their health and well-being and their fertility and reproductive journeys, because I know you do everything from things like PCOS that we're talking about today to infertility issues to perimenopause, menopause. So you really do help the whole gamut of women's health. So thank you. And I know that you're a wealth of knowledge for those that you work with.
Thank you. Thank you for having me again.
All
Always
right.
a joy to talk to you about these
I know,
things.
so good. And if you're hearing this message, I want to say a huge thank you because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can actually apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.